Lawmakers on Capitol Hill are launching an investigation into the baby formula shortage that has many parents scrambling right now. About 40% of the nation's supply is out of stock. The shortage began several months ago, fueled by ongoing supply chain problems. It exploded into a nationwide crisis when Abbott Nutrition recalled 3 types of infant formula in February after 4 babies developed bacterial infections. 2 of them died. The company shut down its largest plant in Michigan. Now, the White House is considering invoking the Defense Production Act to help control the emergency long term. Here with some advice for parents, Dr. Shweta Namjoshi, Medical Director of Intestinal Rehabilitation and Nutrition Support at Stanford Medicine. Thank you so much for joining us.
Thanks for having me.
Well, first, if you're unable to find the brand that you normally use, what is the first step you should take?
Yeah, great question. So we understand that this is really hard for families. It's been really hard for doctors too. I think the first step is really to have a conversation with your pediatrician and not to worry too much, because a lot of these formulas do have very acceptable substitutes and your baby won't have symptoms and they'll be safe for your child. So switching brands within the same category of formula after having that conversation with your doctor is a great option.
Is it safe to switch brands?
Yeah, for a lot of children, it can be safe. So there are some children with disabilities and specific medical conditions for whom they can't switch. But a lot of children who are using either a regular formula or a hydrolyzed or elemental formula, kids can switch within the same category and they won't have symptoms related to the switch.
And health officials are warning parents to avoid European baby formulas since they're not FDA approved. How much of a risk is it if parents are desperate and can't find anything else?
I think I hear the concern that families want to feed their babies and they will go anywhere to find safe food. But I do recommend against using the European formulas. We've seen some complications related to that in specific children. And it's really not regulated, neither is the shipment. And when we've tried to have conversations about what's in those formulas, we've not gotten great answers. So I'd recommend trying to find formula that's acceptable within that same category. And sometimes switching in that same category of formula is more sustainable than finding formula abroad.
Okay, and what else should parents be avoiding during the shortage?
I think it's really important not to dilute formula and not to make your own formula at home. Infants especially are very sensitive to shifts in electrolytes, and we've seen kids unfortunately end up in the hospital from mixing that's gone wrong and have long-term nutrition consequences. So it's much safer to switch formulas in the same category, try out different brands, and have those conversations with your pediatrician, and if you have access through WIC, your dietitian, to avoid those complications.
And hopefully we see an end to this pretty soon.
Yeah. And I think the North American Society for GI Physicians has been advocating at Congress to pass the Medical Nutrition Equity Act to make sure that kids with special medical needs and all of our infants have access to the formula that they need. So that's another way to advocate for our community to make sure that kids get the food that they deserve.
Dr. Shweta Namjoshi with Stanford Medicine, thank you so much for your time.
Thank you for having me.